Good morning, ma'am. This is Hannah Grace Ordillo, your student nurse from Medical Colleges of Northern Philippines. So, for verification po, ma'am, may I know your name po?
Patricia Delis Indian.
How about your birthday, ma'am?
August 12, 2009.
How about your age po, ma'am?
12 years old na.
So, for today, ma'am, I'll be assessing your skin, hair, and nails, and for me, to able to assess those parts. Can I ask your consent po if okay lang po na hawakan ko yung mga certain parts ng inyong body?
Yes.
Okay po. Rest assured po, ma'am, na all of the documents po na manunod ko dito sa ating findings is completely confidential between me po and the attending physician that I'll be referring you to. So, okay lang po ba yun, ma'am? So, I'll be asking you some of the questions about your past history po para malaman ko po, no? So, how are your current symptoms po? Meron po ba kayong skin problems po like rashes, lesions po? How about the dryness po of the skin, oiliness po? How about po yung bruising po o yung pagpapasa po? Okay po. Do you have changes in lesion appearance po? Po. How about yung feeling changes po na minsan may pressure po na nararamdaman, may pain po or may pangangat po? About sa hair loss po, meron po ba?
Wala po.
Sa nail po, may changes po ba sa nails?
Wala po.
Sa body odor po, do you have other problems po?
Wala po.
Sa past history naman po, ma'am, may previous problem po ba sa skin, hair, or nails po?
Wala po.
How about allergic reactions po sa food or sa medicines po?
Wala po.
Okay po. Sa family history po, meron po ba sa family nyo na nagkaroon po ng skin problems or skin cancer?
Wala po.
Okay po. How about sa lifestyle po and health practices? Nagkaroon po ba kayo ng exposure sa sun or other chemicals po?
Wala po.
Sa daily care of skin, hair, and nails po, meron po ba kayong daily care na ginagawa?
Nagtitake a bath every day po.
Okay. So, the usual diet and exercise patterns, what are the foods that you're eating po? Okay, ma'am, that's very good po. So, I already explained the procedure to you, ma'am. So, I am performing a hand hygiene before I start your assessment. Ma'am. Lang po ako ng gloves. May mga jewelries po ba kayong mga suot, ma'am? Okay, ma'am. So, I'll be presenting po for your color variation and your skin po. Pwede po bang mahawakan yung skin po, yung arms po? Okay po? Okay po. I'll just get the magnifying glass po para makita ko po yung mga present things po. Okay, ma'am. How about sa kabilang naman po? So, ma'am, I observed that your skin color is light brown po. And mine observed din po kung quite few most po sa arm po natin, no? And meron din po tayo sa face. Wala naman po akong napansin na any skin breakdowns po na sa ating bodies po, sa ating skin po. Wala din naman po akong napansin na any primary, secondary, or vascularization po na ma'am. And I observed that your skin is quite intact po. So, I'll be performing naman po for the texture of your skin, ma'am. So, can you please give me your hands again po? Okay, ma'am. I observe that are no present stretch marks or scars with your arms po. Only yung mga moles lang po na andyan po, pero wala pong texture, ma'am. Next po is ipapalpate ko naman po yung temperature nyo using the dorsal part of my head po. So, I touch your forehead lang po. Can you do this, ma'am? I have observed po that your skin, ma'am, is warm po. Hindi naman po siya masyadong mainit. Wala naman pong nag-i-indicate na meron po kayong sakit o sinat po. Hindi naman din po dry yung skin nyo and hindi rin naman po oily. Moist lang po siya and that's good to know po, ma'am. So, yung next po na gagawin ko po, ma'am, is i-assess ko po yung turgor po ng skin nyo. So, reach ko lang po ng onti po. So, yung next naman po na gagawin ko po, ma'am, is i-assess ko po yung turgor po ng skin nyo. So, reach ko lang po dito. Grabe na naman. Okay po. And yung dito naman po sa baba, ma'am. Okay po. I observed that there are no pressure of edema po, no? Nung tinouch ko po yung legs niyo po and yung feet niyo po. Bumalik naman po siya agad. Hindi naman siya nag-indent. And nung pinouch ko po yung skin niyo for our turgor test, meron naman po siyang mobility and bumalik naman po siya agad. So, ayun po ma'am, I observed that your skin is quite thick din po and that's good po. So, for the next part of our assessment po ma'am, I'll be inspecting your hair po. So, okay lang po ba i-touch ko po? Okay po. Just gonna inspect lang po sa likod po. Okay po. Okay po, ma'am. Ask ko lang po kung kailan po kayo last na nagpakulay ng hair. 6 months. So, I just observed po na medyo may kanipisan na po yung hair natin. But, wala naman po akong nakitang any scars, any lesions po na meron sa hair niyo po. Wala din po akong nakitang mga parasites na presence or infestations po, ma'am. And wala din po akong napansin na any oiliness or dryness po pagdating sa scalp. And wala din pong present na hair loss po or pwede pong mag-lead sa alopecia po, no? So, yung napansin ko po sa hair niyo, ma'am. Next naman po na gagawin ko po is yung sa ating nails. So, pwede ko pong makita yung pang nails natin sa loob mo. Sinecheck ko lang po yung nail plate if nakadikit po siya sa nail bed niyo po. Okay, so I observed, ma'am, that your nails are quite groomed and it's clean po. Pink tones din po yung nails natin and nakadikit naman po siya. Wala naman pong nakaangat or any loosen of the tissue sa ating nails. Next naman po, ma'am, I just pinch this po. Okay. Yung next naman po ba, na assessment natin, pwede pong gawin po natin ito sa nails natin. Okay, ma'am, thank you po. So, ayun po, ma'am, napansin ko po na meron pong 100 degrees po na flip po yung nails kapag po ginanon niyo po siya. And that's normal po. And napansin ko rin po sa ating capillary refill or blanchless po, bumalik naman po agad yung pagkapinto ng ating nails po. Nung pinis ko po siya and rinalis. And that's a good sign po, ma'am, no? So, maganda naman po lahat yung mga nangyari po sa ating assessment. So, ayun po, ma'am. Punta naman po tayo sa next nating assessment, which is the head and neck. So, for today, ma'am, I just explained the procedure that I will be doing to you. I'll be assessing your head and neck for me to able to assess the certain parts of your body, specifically in the head and neck part. So, is it okay with you, ma'am?
Yes, ma'am.
Okay. So, rest assured that all of the documents and findings are completely confidential with me and the attending physician that I'll be referring to you. So, ma'am, do you have any questions?
Wala po.
Okay po. Before I start, ma'am, I just have a quick history about you. So, are there any lumps and lesions on the head or neck that do not fill or disappear? May mga ano po ba, lumps na mga bukol, masses po? Wala naman po. How about difficulty po? Hirap po ba kayo sa pag-move ng head and neck po? Ma'am? Okay po. How about sa facial or neck pain po? Meron po ba kayong mga frequent headaches?
Wala po.
Okay. Nahihila po ba kayo minsan o nawawalan po ng malay? Okay po, ma'am. How about po sa past history naman po tayo, ma'am, no? Is there any previous head or neck problems, trauma or injury po?
Wala po.
Sa family history po, meron po ba sa family niyo na meron or nagkaroon po ng head or neck cancer?
Wala po.
How about sa family history po, ma'am, of nagkaroon po ba kayo ng migraine or headaches?
Wala po.
Sa lifestyle and health problems po sa last part, nag-smoke po ba kayo or nagchichi ng tabako?
Hindi po.
Okay. Do you wear a hat or helmets po? Hindi naman po. How about naman po sa pagtulog nyo? Ano typical na posture nyo kapag natutulog?
Nakakain mo.
Okay po. How about sa type of recreational activities po or ginagawa nyo sa inyong free time ganun po, ma'am?
Tinutulungan ko po yung kapatid ko na mag-vote.
Okay, ma'am. So, I performed the assessment na po. Stop mo. Okay, ma'am. The first part of our assessment, inspect ko po yung face nyo, ipapalpit ko po yung head nyo. Okay lang po ba?
Yes, ma'am.
So, okay, I'll be palpating your head po, ma'am. Okay, so I just observe your scalp po, ma'am. I just check from the back, ma'am. Okay, ma'am. Okay, ma'am, I just observed that your head is symmetrical, it is round, it is erect, it is in the midline, and you are normocephalic, which means your head is appropriate in your body. I don't see any illusions, scars, masses that is present in your head. There are no parasites present like lices and I haven't observed any alopecia. So next one, ma'am, I'll be checking your facial symmetry and your facial movement. Symmetry. So, okay, I guess okay. Pag-ibaba ko yung face mask. Okay, pataas mo na po yung face mask, no? So, next one, ma'am, I'll be checking your cranial nerve. 7, which is facial nerve. So, please do the things that I'll tell you to do. So, next one, ma'am, I'll be checking your cranial nerve, number 7, which is facial nerve. So, please do the things that I tell you to do. So, please your eyebrows po. Okay. Ang ibaba niyo po. Can you please blink your eye for me po? Why can I po? Okay. Close your eyes po tightly. Tightly po. Tightly pa po. Okay, open na po. Next po is smile po. Okay, ba ba? Okay po. Prone po tayo, ma'am. Ganun po. Pagkitaas na po ini. How about po yung puff po yung cheeks? Ganun po. Okay po. Pagkitaas na po. That's very good, ma'am. Wala naman po akong nakikitang abnormalities nung ginawa niyo po yung pag-observe ko po sa facial nerve. Okay, ma'am, I didn't see any drooping on the face. Hindi naman po siya na-droop sa kabilang side at hindi rin na-droop sa kabilang side. Pantay lang po at pantay po. So, next one, ma'am, I'll be palpating your temporal artery. So, next one, ma'am, I'll be palpating your temporal artery. So, allow me to touch po again, ma'am. Can you please bite your teeth, ma'am? Again po, ma'am. Release po. Tapos bite. Tapos release. Okay po, ma'am. So, next one, ma'am, I'll be checking your temporomandibular joint. So, here po. Pakibaba po yung face mask. And can you please open your mouth po? Open po. Okay, close po. Again po. Open po. Okay, that's okay po, very good. I haven't seen any swelling po and hindi naman po ako naka-observe ng any clicking. Nung ginawa ko po ba yun, ma'am, nung chinek ko po yung temporomandibular joint nyo and yung temporal artery, nakaramdam po ba kayo ng pain or tenderness po? Hindi naman po. Okay, that's good to know, ma'am. So, nakaranas po ba kayo ng any headaches these past few days, ma'am? Hindi po. Okay, so that's good to hear, ma'am. Next naman po ng ating assessment is yung sa neck part po. So, I'll be checking your neck part po. So, I'll observing this one po. Okay po. Can you please sip a small amount of water po? Pagkainom niyo po, hold niyo po muna sa mouth yung water po. Ito lang po. Pagkainom po. Okay po. So, I can see po that your trachea is in the middle line and nung lumunok naman po kayo, okay lang naman po yung naging process ng pag-up dito sa part na ito. And that's normal po, ma'am. I don't see any bulging or any swelling pagdating po sa ating neck part. So, nung nag-sit po kayo, nakaramdam po ba kayo ng tenderness or pain po? Okay. That's good to hear, ma'am. So, I'll just note that hindi naman po kayo nagka-trouble sa paglinok po, pag-swallow po. Okay po. So, next part of our assessment, ma'am, I'll be checking your cervical vertebrae po. So, posteriorly, dito po siya i-assess, ma'am. Po. Can you please look to the side po? Tapos pakitaas po ng side po. Tapos taas po. How about sa kabila naman po? Ganun po. Okay, ma'am. I don't see any irregularities naman po nung ginawa niyo po yun. And next po naman po is i-check po yung range or neck motion niyo po. So, can you please look to the ceiling po? How about po sa floor po? Okay. Can you look here po? Okay po. And can you look here po? Okay, ma'am. Do you feel any tenderness or pain po nung ginawa niyo po yung procedure? So, that's very good, ma'am. Next one, ma'am, I'll be palpating your trachea po para po malaman ko po kung may blended or possibly dito ko po siya ipapalpate. So, just that, capture trachea po, ma'am. Dito. Palpate ko lang po, ma'am. Observe ko naman po, ma'am. And I can feel na nasa middle po siya. Po. Can you swallow po, ma'am? Swallow pa po. Next po. Next po, ma'am. Okay, that's po. I can see that your trachea rings are working po and good naman po yung pag-swallow. Now, ma'am, can you please look up? Then, face po tayo dito. Dito. Then, face naman po tayo dito. Okay, ma'am, nasa middle line naman po yung trachea mo. Next one, ma'am, I'll be assessing your thyroid gland to see if there are any present leaks. Okay po? Can you please hold your breath po, ma'am? Inhale po. Hold yan po. Exhale. Inhale po. Hold yung here. Exhale. I can see that there are no present roots po and your cervical carotid artery are functioning well. So, for the last one po, ma'am, I'll palpate your lymph nodes. So, allow me to touch your feet again po. Tagalin na po natin. So, right, I'll palpating your post-auricular nodes. Po. Your ocular nodes po. The occipital nodes po. Okay po. Relax lang po yung face. Submental nodes po. The superficial cervical nodes. Deep cervical nodes. And the posterior nodes po. And the supraclavicular nodes. Okay, so that's the last part of your assessment, ma'am, from the head and neck. If you have any questions or clarifications, or if you felt anything in your health po, I refer you to your attending physician po, and siya po yung mag-explain lahat ng things na kailangan niyo pong malaman. So, ito po, ma'am, yung assessment po na ginawa natin is para po ma-treat natin yung necessary needs natin, no? If ever na nakahanap ng abnormal findings, and I don't see any abnormal findings naman po. So, ayun po, ma'am. Thank you po for your cooperation, and yung masasabi ko lang po for the help is to drink po your vitamins. So, today, ma'am, punta naman po tayo sa assessment ng inyong eyes. So, I'm just gonna explain to you the procedure that I'll be doing. So, for today, I'll be assessing your eyes, ma'am, for me to be able to assess those things. I must perform some vision tests, some extra ocular muscle functions, and some of the external eye structure. I'll be inspecting those and palpating your parts of the eye po. So, is it okay that's with you, ma'am? So, let's assure, ma'am, that all of the documents or the findings that I'll be noting will be completely confidential between me and the attending physician that I'll be referring you to. So, is that okay with you, ma'am? Okay. So, before I start, ma'am, I'll be asking you some questions for the current symptoms. Meron po ba kayong naranasan na any changes in vision po? How about spots or floaters in front of your eyes po? May mga kapag po tumititig po ba kayo sa isang object, may mga nakikita po ba kayong lumulutang? Have you ever experienced trouble seeing at night? Hindi hirap po ba kayong mag-focus sa objects o pagtingin sa mga bagay kapag gumagabi po? Okay po. Have you ever experienced double experience po? Hindi naman po. How about eye pain po? Redness or swelling in the eyes po? Meron po bang nagkaroon po ng ganun po these past few weeks or past few months? Wala naman po. How about excessive watering po or tearing of the eye? Nagdi-discharge po sa mata kapag po ba? Sa pag-history naman po, may previous eye or vision problem po ba tayo? Meron po. For the family history po, meron po ba sa family niyo na nagkaroon ng eye problems or vision po, ma'am? Sa lifestyle and health po, meron po ba kayong exposures sa any chemicals, fumes, smokes, dust, or flying particles? Meron po. Are you wearing eyeglasses, ma'am? Okay. So, that's all po, ma'am, for the questions. I'll be proceeding to the assessment of your eyes. So, is it okay with you, ma'am? So, I'll be performing inspecting the external eye structure. Is that okay with you, ma'am? I'll just observe for your face symmetry, your eyelids, and your eyebrows po. Okay, bye-bye. Okay, focus lang yun po ulit. I can see, ma'am, that your eyelashes is evenly distributed. It was symmetrical and your eyeballs are globe, firm, and there is no tender. I can see no swelling of the eyeballs po. So, next one, ma'am, I'll be inspecting the vertebral bulbar conjunctiva po. So, can you please look there, ma'am? Look there po. And can you please look up po? This is the bulbar conjunctiva. Okay. You can see, ma'am, that in the part of vertebral conjunctiva, there is no jaundice, there is no redness, there is no swelling, and there is no sign of sinuses. Also, in the bulbar conjunctiva, there is no things that is such swelling and redness po, ma'am. Next one, ma'am, I'll be inspecting and performing you po the informal apparatus. So, can I palpate po, ma'am? Close your eyes. Open your eyes, ma'am. Okay po. I can see that there are no swelling, there is no redness, and no presence of edema. When I touch your face, ma'am, do you feel any tenderness po? Wala naman po. So, for the next one, ma'am, I'll be inspecting your iris and pupils. Is that okay with you, ma'am? So, can you please stare at me? I'll just check your iris po, ma'am. Okay, just follow the pen lang po. Ay lang po ang susunod, hindi po isasama yung ulo. Okay. So, next one, ma'am, I'll be inspecting for the clear light reflect. So, I just turn off the lights. Okay, ma'am. So, I'll be inspecting your pupillary light reaction. So, can you stare at the distance, ma'am? Distance. Okay po, distance lang po. Yung mata lang po. Tingin po dito, tapos sa likod lang po. Distance lang po. Distance lang po. Dito po sa kabila. Tingin po dito, ma'am. Dito. So, yun lang po yung assessment natin sa eye, ma'am. Punta naman po tayo sa ating next assessment, which is the ears. So, for today, ma'am, I am going to examine your ear. So, for the ear, we have different procedure. So I'm going to start with inspecting your external ear, and then I'm going to perform the tab test, and then followed by a palpation of the areas surrounding your ear. And then I am going to use a pen light to check the internal or the insides of your ear. So this is to check your ear canal as well as your tympanic membrane or yung tinatawag nating eardrum. So next after that, I am going to perform Fitz void test. So for this test, I'm going to check your auditory acuity, or this is to assess, ma'am, if meron kang having impairment. Okay, so lastly would be the Weber's and Reinage test. So for the Weber's test, ito yung test para ma-check natin yung lateralizations kung sa isang ear lang ba kayo nakakarinig, mostly or both ears. And then for the Reinage test, it is to check for the ear conduction as well as the bone conduction. So basically, itong Weber's and Reinage test, these are tests to assess kung meron tayong hearing loss, okay? It would be conductive or sensory neural hearing loss. Okay, so let's start. So first, I am going to inspect your external or outer ears. Okay, first, the ears are symmetrical and auricular. They are no infirmities, no presence of bones and skin lesions. Okay, there is no scars as well. So I'm going to check the posterior portion of the ear. Okay, so for the posterior portion, there are no scars as well. So now, ma'am, I'm going to perform the tag test. So for the tag test, I am going to pull your helix. This is helix up and down, okay? And then sabihin mo sa akin kung meron kang mafe-feel na pain. So I'm going to start with the with the left ear. May pain ko ba? So now, ma'am, I'm going to perform the tag test. So for the tag test, I am going to pull your helix. This is we call helix up and down. Okay, and then sabihin mo sa akin kung meron kang mararamdaman na pain. Okay, so I'm going to start with the left ear. May pain ko ba? Dito. Next, sa right ear. May pain. Dito. Okay, so usually kasi meron tayong pain na nafe-feel, it could be due to an infection. So since wala namang pain, so there is no sign of infection. Now I am going to palpate the area surrounding your ear. Okay, starting with the anterior auricular. Meron ba? How about the intra-auricular? How about the posterior? Okay. So for palpation, there is no sign or presence of tenderness and swelling. Okay, now we will proceed to the internal portion of the internal ear. So I'm going to use my pen light. So this is my pen light. We may find uncomfortable kasi baka parang nakikiliti kayo or parang masakit. So I'm going to as fast as possible. So I'm going to check the light first. Okay, I'm going to adjust the right ear. Okay, now we will proceed to the internal portion of the internal ear. So I'm going to use an otoscope. So this otoscope, we may find uncomfortable kasi baka parang nakikiliti kayo or masakit. So I'm going to as fast as possible. So I'm going to check the light first. Okay, I'm going to assess the right ear. So for the ear canal, there is presence of hair. For the ear canal, there is presence of hair. There is a presence of cerumen, and then in the tympanic membrane, the color of the tympanic membrane is pinkish to gray. And there is no presence of muscularization. The quercen as well as the placid is intact. For the handle of Malleus as well as the short process. Okay, they're in oblique portion and situated behind the upper part of the eardrums, and there is also presence of for my life. Okay, so next, I am going to perform the whispered voice test. So this is what I said earlier. The whispered voice test is to assess whether there is any hearing impairment. So for the whispered voice test, I am going to stand behind you, ma'am, and I'm going to occlude one ear, the non-test ear, by gently rubbing the tragus in circular motion, and then I'm going to say numbers or letters, and gusto ko sabihin mo sa akin kung ano yung mga sinabi ko na numbers and letters, okay? So I'm going to stand behind you, and I'm going to start with the left ear.
3A1.
Okay. On the right ear,
260.
okay, very good. Okay, so for the whispered voice test, so far so good. Wala namang any abnormalities. So we will now proceed to the Weber's and Rene's test. So for the Weber's and Rene's test, I am going to use a tuning fork. Okay, so we will start first with the Weber's test. So for the Weber's test, I'm going to induce vibration. So gaganunin ko siya, and I'm going to place it in your mid-forehead. And then sabihin mo sa akin if yung sound naririnig lang sa one side or both sides, both ears. Okay, so I'm going naririnig sa both sides or sa okay. So I'm going to start now. So now we will proceed with a Rene's test. So for the Rene's test, same lang. I'm going to use tuning fork, and then ang difference lang nito is I'm going to place it in your muscoid bone. Dito. Behind your ear. And then sabihin mo sa akin if naririnig mo ba or hindi na. Kung hindi na, I'm going to transfer it in here, in your ear canal. Okay, so I'm going to start with your right ear. Next, on the left ear. Okay, so for the examination of the ear, I were to summarize all the results were good. Starting with the inspections to the palpations for the tag test, as well the whispered voice test and the Weber's and Rene's test, wala namang abnormality akong nakikita or na-notice or na-note. So, for the how to care to our ear, people have this kind of misconception na we have to clean our ears every day. Okay, so actually, it is not advisable not to clear the ear every day. Because yung earwax, hindi talaga siya completely dumi. Earwax are lubricants. So, binibigyan siya ng moisture ang ear. Okay, so also yung hair natin sa ear, they serve as sila yung nagfi-filter kung merong mga bacteria. So, sila yung first line of defense para hindi talaga tuluyang papasok yung sa ear na yung mga dirt or yung mga bacteria. So, tapos na po tayo sa ear, lipat naman po tayo sa mouth assessment. So, today, ma'am, I'll perform your assessment to your mouth and oropharynx. So, this is essential necessarily in order for us to find out if there are any abnormalities in your mouth and oropharynx. So, not only but to examine the baseline or initial information of your oral cavity. So, for your cooperation, I just want you to follow my instructions so that we can do it fast and easy way. So, before I start my assessment, ma'am, I'm going to ask you some questions. What is your routine pattern of dental care? How many times do you brush your teeth, and is it after every meal? Do you use floss or mouthwash? Mouthwash? Okay. So, when is your last visit to your dentist? 5 months. So, is there any present of rows or other reasons at the moment? Like, do you have tonsils right now? Okay. So, do you think medication that you are medicated to you? Okay. Kasi sometimes medicine are not suitable for the patient and it might poison a person. So, okay, ma'am. Do you wear a dentures right now, ma'am? Okay, thank you, ma'am. So, okay, ma'am, are you ready in your comfortable position? Okay. In this procedure po, I'm going to use a pen light and tongue depressor. So first, I'm going to assess your lips and buccal mucosa po. And I'm going to inspect the symmetry of texture, color, and contour. So when we say symmetry of contour po, is the ability of the lips to first. When we say color po, sometimes the color of the lips varies to different persons. Sometimes the color of the lip is pink, pinkish, yellow, or black. And it is important kasi po, sometimes it may be indication of the health problem like when it is blackish sometimes. It is the result of bad habits of too much smoke po, too much cigarette po, sometimes money when it's spilled po. There is the reason of anemia. When we say naman po sa texture, the normal lips should be moist and smooth. So that it is normal. Okay po. So the texture po sometimes may determine problems. So I'm going to palpate po your lips and buccal mucosa for its color, texture, moisture, and if there is a presence of emissions po. I'm going to use the tongue depressor and pen light. So can you please place your lips when you're going to whistle po? Okay. The next one, ma'am, I'm going to examine your teeth and gums. For that po, I'm going to examine your teeth. For the teeth, I'm going to examine the number of teeth that present if there are any problems po. And for your gums po, I'm going to examine first the color, bleeding, presence of bleeding, edema, and lesions po. Okay?
Go.
So, in other patient po, we inspect their dentures po. Since you don't have any dentures, it is okay. Pero in some cases po, we ask the patient to remove and inspect their dentures. So, the next one, ma'am, I'm going to assess the tongue and the floor of the mouth po. Next one, ma'am, I'm going to assess the tongue and the floor of the mouth. So first, I'm going to inspect the position, the color, and the texture. The position it is when your tongue is in the center po and its ability to suck po. So, I want you, ma'am, to protrude your lips. Okay, next po, I'm going to inspect the movement of your tongue. Can you please roll your tongue po upward? Okay, side by side. Okay. So next one, ma'am, I'm going to inspect the base of the tongue po. The mouth floor and the frontal lobe, I want you to put the top of your tongue to the roofer mouth. Okay? So far, I'm going to palpate the floor of the tongue for any nodules, lumps, or excoriated areas. Say I. So, I'm going to use gauze pads po to touch or hold your tip of the tongue po. And I'm going to use my index finger to touch for the up borders and the taste.
Go.
So next po, ma'am, I'm going to inspect their salivary glands po if there are lack of openings for any swelling or redness. Just open your mouth po. So now, ma'am, I'm going to assess your palates and uvula po. First, I'm going to inspect the soft palate for color, shape, texture, and the presence of bony prominences. So I want you to open your mouth, ma'am. So lastly, ma'am, I'm going to assess your oropharynx and tonsils. For oropharynx, ma'am, I'm going to inspect the oropharynx for color and texture po. I'm going to use the tongue depressor po. So next, ma'am, I'm going to inspect the tonsils for color, discharge, and size po. So please open your mouth, ma'am.
Pakitaas po yung dila.
So that's all of our assessment in mouth and oropharynx, ma'am. Proceed naman po tayo sa ating nose.